Welcome to the Alliance for Patient Care, an organization dedicated to advancing smarter healthcare policies that empower both patients and providers. Through innovation and advocacy, the Alliance supports stronger, healthier communities.
Hey everyone, thanks for joining us today. For those of you who have not joined our previous webinars, my name is Jennings DePriest. I'm the chairman of the Alliance for Patient Care. And we have a very special webinar today. This is a little bit different than the webinar series that most of you are used to. Today we are talking about the next steps now that CMS has closed the comment period on the rule changes. The LCD is still slated for January. And the question is, what do we do while we are running out of time? And we have some very special guests with us today. We have Jonathan Kilman, who's with Converge Public Strategies. We also have his partner, Elnatan, Rudolph. We have Yvonne with us over from iCare. Some of you may recognize Yvonne from a previous webinar. And we have Bourque from Regenaskin Solutions, who was on our very first webinar. And what we're talking about today is what we can do between now and the rule changes going into place, or the LCD changes going into place, to prevent those changes from happening, or at least create a favorable outcome for the skin substitute industry. And if you're wondering, hey, I thought the Mass Coalition was doing this, and the Mass Coalition is doing great work. But the point here is for the small business voices of the industry, clinicians like Yvonne, distributors like Blake, to have their say, because we know that's many of you own clinics. Some of you are also distributors like Blake is. And it's important that we have a voice at the table and a voice in Congress that is speaking up for us from a policy standpoint as things move forward. So if this is your first webinar joining us, the mission of the Alliance for Patient Care is very simple. It's advocacy, connection, and education. We're here to unite providers and patients, and those who support providers and patients to support advanced wound care. Together, we are the voice of the independent small businesses and the clinicians. Again, there's voices from the manufacturers, large and small, the manufacturers who want to shut out the small manufacturers, obviously have a quite large voice. The smaller manufacturers have the Mass Coalition, and the purpose of the Alliance for Patient Care is to have a coalition of the small businesses who are on the ground working with patients and working with providers on a daily basis. So I wanted to introduce you to our advocacy team. We've selected Jonathan Kilman and Elnatan Rudolph over at Converge Public Strategies to support us in the DC fight. They are top DC lobbyists with deep policy connections. They have direct ties to the Trump administration and are focused on protecting access for small practices and independent distributors. They have a deep history in building coalitions and leading direct advocacy within CMS and within Congress. Jonathan's resume speaks for itself. We'll bring him on now so he can talk a little bit more about his history, his background, and his thoughts on advocating to stop this rule change, or again, at least edit the rule change so that it's favorable to independent clinicians. Jonathan.
Well, Jennings, thank you. It's a pleasure to be here today. I look forward to collaborating with you and your colleagues. Obviously, this is an issue that is near and dear to the hearts of the people who are a member of this alliance, and you and I have had extensive conversations about it. I'd like to give a little background about our firm and our professionals. My name is Jonathan Kilman. I'm the chairman and co-founder of Converge Public Strategies. Our firm has been technically in existence since 2018. Our professionals, obviously, due to our lack of hair or gray hairs, have much more experience than that. I'm an attorney by background. I have experience in mergers and acquisitions and venture capital transactions. In the early stages of my career, made a significant pivot thereafter into the political and governmental realm serving as counsel to a Speaker of the House, serving as counsel to governors, administrations, and ultimately beginning to represent private clients in governmental matters. Together with my colleagues, we have represented hundreds of interests in government matters of all shapes and sizes on behalf of coalitions, on behalf of global organizations, and we even represent governments in matters, including in healthcare matters. So I think it'd be useful to share some of their bios today and mention some of the key areas of healthcare that we've been involved in helping to drive reform. So Jennings, does it make sense to start with some of the bios of the key members of our team?
Absolutely.
Great. Well, as I mentioned, myself, I'm an attorney, have been involved in dozens and dozens of healthcare-related matters, including representing payers, providers, hospital systems, multi-specialty clinics, and a wide array of allied healthcare services, device manufacturers and distributors, as well as pharmaceutical manufacturers and distributors. So I think it's fair to say we've operated in every niche and every corner of healthcare at Converge and together with our professionals. Paul Lowell, who's also a co-founder of Converge with me, also an attorney by background. He previously served as the health policy chief for a state governor and was the leading architect of the statewide Medicaid system in that state. And together we've worked on a wide variety of issues, including starting our own coalitions. And in fact, by way of example, I mentioned in Florida, we saw that at the federal level and state levels early on in telehealth, there just wasn't a lot of meaningful policy traction on issues like parity for reimbursement and or even the ability to prescribe medications via telehealth. So Paul and I created the Telehealth Association. Florida brought together various substantial players, global players, national players, and regional players to form a coalition. Our work was at the forefront of ultimately resulting in legislation that enabled prescription of medication via telehealth. And we're very proud of that work. That work then proliferated around the country, and we can see the hallmarks of the work we did there in even today's policies related to telehealth. So that's one example of the work that we've done. Another person I mentioned in our firm that I think is of significant relevance here is Randy Pate. Randy was the deputy administrator of CMS in the first Trump administration. He was also the director of consumer information insurance oversight at CMS in the first Trump administration, where he was directly responsible for leading the turnaround of the health exchanges. I mentioned that to say I think Randy in particular has significant credibility with the current policymakers and key decision makers in the executive branch. But more than that, he also served in Congress as a lead staffer to several committees, including Ways and Means. And I think that's particularly relevant because if you look at the activity on this topic in the Senate Finance Committee, I think you'll see on the House side, Ways and Means is where a lot of the activity would occur. And I think we have, in addition to Randy Pate, our colleague James Harris, who has strong ties to that committee's leadership. And so I think when you look across the varied experience of our firm is made up of nearly 50 professionals across North America. I'm sure that if you were to look across the resumes of our professionals, you'd find more and more relevance. But those names stand out, just to name a few. Of course, we have extensive relationships across Congress. So to the extent that we need to contact members of Congress to get them to weigh in on rulemaking or any other executive branch activity, we can do that. And I would say it's our experience that when you're working with a coalition, what's really important is the ability to connect the members of that coalition and their stories to proposed action, especially if it's happening in the executive branch where there may not be as much direct connectivity as in Congress, where you've got members of Congress from those direct connectivity to their local jurisdictions. I think what we can do is help your alliance reach out to their local members of Congress using our personal relationships with those members to facilitate it, build credibility, and let them know that your members are being directly affected, and figure out the ways that we can work together with the Alliance to leverage those relationships and make sure that we send a message through our advocacy or alongside our advocacy into the executive branch. So we won't serve as a buffer to your members. We'll serve as a magnifier of the impact of your members in advocacy towards the executive branch, and hopefully have a significant impact on rulemaking. And we're ready to go immediately because of the connectivity of our firm, the fact that many of us are in Washington, D.C. Either every day or every week. We have the ability to hit the ground running, activate very quickly. And we also have members who are spread out in different parts of the country to help the ground game as well and get things moving right away once we get engaged.
Excellent. Well, thank you, Jonathan. I appreciate that. I might bring you back in for some additional questions as we continue. But I think that's a great overview of this. And it's so important for people to realize that in politics and in policymaking, if you're not at the table, you're on the menu. And unfortunately, right now, clinicians and distributors are not at the table. And it's a big risk moving forward.
I couldn't have said it better myself. If you're not engaged in this process, unfortunately, the process doesn't wait for you. I look forward to answering any questions. And I also have some other good examples of where we've been involved in ways that have stopped enforcement where the government was seeking to restrict reimbursements inappropriately. Happy to talk about that. But again, thank you for having me on today.
Awesome. Thank you, Jonathan. So if you're wondering what you can do to get involved, we've put together membership levels because Jonathan and his team are not free. This is a relatively significant undertaking to hire highly skilled lobbyists. And we've put together 3 quarterly membership levels here. Obviously, calling it an annual membership would be a little interesting considering all of these decisions are going to be made in the next 3 months. The goal would be to have long-term advocacy, long-term representation, but we basically have between now and Thanksgiving to have our voices heard in DC. So we have 3 levels. We have the advocate level, which is a one-time $5,000 donation. You'll get monthly legislative updates throughout the rest of this process. You will get advocacy alerts and toolkits. You'll also be recognized on the AFPC site as a member, and we'll have some specific quarterly expert webinars. Those will really be with Jonathan or members of his team who can give you updates in a format like this on what they are doing in DC and what they are hearing in DC. Champion level, you are going to get an additional quarterly call with the lobbying team. That will be a 2-way Zoom call. You will also get your logo placed prominently on the homepage of the FPC website. We will be arranging some Capitol Hill days, and you'll also have some VIP events that you'll have access to. And then for our guardians, for those who are willing to contribute $15,000 to keep access for patients going here in the skin substitute and advanced wound care industry, you get to sit on the advisory council, which means that you'll help advise us, the Alliance for Patient Care, on the policies that Jonathan and Elnatan and the Converge team will be advocating for. You'll have specific briefings with me and with other members of the leadership team. If we need somebody for a media opportunity, you will be one of the first people we call. We'll go to our Guardian level members first, which is great content, great social proof, and it's an opportunity for you to get your voice out there and show your patients, show your providers, if you're a distributor, that you are advocating strongly for the industry. And there will also be the opportunity for coordinated congressional introductions, which means it's not just Jonathan and Elnatan going in to advocate. It is Jonathan and Elnatan and you as the provider going in to advocate for your patients. It does make a big difference when the providers, the people who are boots on the ground, working with patients day in and day out, are able to come in and make an impact. So if you are interested in joining, again, now is the time to join. Your membership is going to protect the patients, it's going to protect practices, and it's going to protect the future of the industry. It's not too late to be heard. Call your senator, call your congressman, regardless if you're planning on joining as a member. It's important that we continue to speak. But if you're interested in joining as a member, you can email us at info@allianceforpatientcare.com. You can also scan this QR code, and you can give us a call or shoot us a text at this phone number. We will get back to everyone as quickly as possible to make sure you have all of your questions answered. This time, I'm going to bring Yvonne and Blake on to talk about their take on this, their take on the future of the industry, why this is so important, and why the rule change has to be stopped or changed.
Hey, Jennings, thanks for having me. And again,
yeah, thanks. Thank you both for being here. Really appreciate it. Hey, Yvonne, let's start with you. You're a provider. You work with patients on a daily basis. Can you talk about how the current proposal would affect your business, and why you've decided to join the Alliance for Patient Care to help fight that?
Yes, so it's very simple. Quite honestly, if the changes go as proposed, this would effectively shut down my business starting January 1st. The reason why is because, first of all, I own a mobile wound care clinic. So this means that I bring medical providers to patients' bedsides. And the reason why this is beneficial, other than the obvious of the convenience, is a lot of these patients are bedbound. A lot of these patients are elderly with minimal resources and minimal access to doctors. And that's part of the reason why their wounds are not healing, is they just can't go to the doctor every couple of days like it's required for somebody to take care of them. So instead, we bring medical providers to them and we treat them on the bedside. And this is all covered by insurance. The issue is that, CMS has not changed the rules on reimbursement for mobile clinics. So we get reimbursed at the same rate as a traditional brick and mortar clinic. Well, it takes me an hour to get to the patient in Miami. I treat the patient for an hour, then it takes me another hour to drive back. And that's 3 hours with one patient. And with the proposed rates, I would not be able to run a profitable business. I will physically have to shut down. And that's pretty detrimental to patient care. Right now, mobile clinics in the past 5 years have grown drastically. So the majority of wound care clinics currently, as it stands, it's mobile clinics. So most of those clinics would cease to exist, including myself. So again, I feel that CMS is being very short-sighted because they are failing to calculate the cost that it would take for this patient to be treated at a hospital. Because if I don't exist, the patient is in an ALF. If I don't exist, this patient bounces to the hospital with an infection, with sepsis. Calculate the cost of that, and then also calculate the cost of an amputee, taking care of an amputee, because that's what happens when these wounds don't get treated. And then take it further, the survival rate, the 5-year survival rate for an amputee is less than 50%, which is worse than most cancers. So again, I repeat that this, in the spirit of trying to save money, we're actually going to drive up healthcare costs and at the expense of patients' lives on top of it.
Yeah. And again, that's why voices like Yvonne, like the other providers who are watching this or are watching the replay, matter so much before Congress. Yvonne, you see patients on a daily basis with this in environments that are very different from the hospital environment. Going back to the actual language of the rule change was basing skin substitutes on a hospital environment reimbursement. But that's not where most wounds are treated, and it's much more difficult to treat a wound when somebody is in an environment that may not be a pristine, clean hospital room. It might be, lower income housing. There may be mobility issues that keep them from keeping their homes as clean as they would like to. And that can really impede the healing process.
Yeah, and it's not just maybe, that's actually primary, the patient database of chronic wounds are exactly what you described. That's the majority, not just the minority.
Yeah. Blake, I know you're a distributor, so on the distributor side, we'd like to hear from you because there's the manufacturer voices and there's the big manufacturer voices, but this does impact the distributors who work directly with doctors. And so can you talk about how this is impacting your strategy over your company and the way that you're approaching plans for patient care if this were to go into effect?
Yeah, Jennings, thank you again for having me back on the podcast. Look, I want to give Medicare the benefit of the doubt on this one. I think they're listening to the loudest voices. They're listening to voices that have access to get to them. I think there are people in rooms right now that have an agenda and they have products to sell that are basically been put inside of hospitals. And because of the ASP model, the prices have eroded and they're not coming out with any new technology. And from my viewpoint, I've seen side-by-side comparisons in healing rates. Some of their products don't work as good as the newer products that have come out that are really allograft and amniotic fluid based. And so we need to be a voice that they listen to. Just to be clear, like the Alliance for Patient Care here is giving providers and distributors the opportunity to be able to advocate on behalf of patients because our voice needs to be heard. And what Jonathan Kilman and Elnatan and Rudolph are doing is giving us that opportunity to get backstage with those voices. I mean, that's the whole point of this, just to kind of reiterate it, what I'm looking at. And in advocating for patients, I have the very rare opportunity to be able to be bedside with providers like Yvonne, laying skin substitutes. We have an opportunity to be able to go into patients' homes and see the environment. And I will tell you, when there is a very large economic disparity, when I'm talking about when we have generational poor areas, those wounds aren't healing. And they're not healing because of lack of nutrition. They're not healing because of lack of care. They're not healing because of infection. They're not healing because the patients don't have the ability or mobility, like the transportation, to be able to get to the wound care center. And when they do get to the wound care center, it's very surprising how little wound care happens there. And I'm not trying to disparage people who've committed their lives to helping patients. I'm saying that there are unfortunately a lot of physicians that are stopped learning. Graduated from medical school, they got into practice, and they stopped learning. And so it's our job to continue to educate physicians on new techniques. That's the role of the distributor. That's the role of a medical sales rep. Pharmaceutical companies do it. Surgical supply companies do it. Laboratories do it. Other ancillary service providers do it. We collide with the existing worldview of medical care, and we inculcate new ideas and create new opportunities to advance patient care with technology and innovation. And so with or without skin substitutes, we're going to continue to do that. But I will tell you, this God-given gift, this is the only thing, Jennings, that I've ever sold. This isn't my words. This is a person who works for me, Barbara Helton's words. She said, Blake, this is the only thing we've ever sold that's God-made. It's amniotic fluid, man. It's placenta. It's something that is given to us. It's a gift of God. We have an opportunity to lay it on lay it on a wound, and we watch healing happen. It's not a wound covering. It's not an expensive bandage like the New York Times writes a hit piece on. It is something different. And it's not just the bandage. It's the service, right? It's not the covering. It's not the material. It's the prep work. It's the 30 days of conservative care. It's the alignment with the LCD. It's the reviewing of diagnostic labs. It's making sure the patient's nutrition's right. It's making sure that they're offloaded. It's everything that Yvonne has to do and his team has to do to be able to prep, to do it mobile in a patient's home, keeping it sterile and keeping it effective. And so if we want this advocacy and we want veterans to be healed and we want patients to be healed and not go to the hospital, where I promise you their hospital bills are going to be higher than these wound care bills. Because once they get into the hospital and they're a Medicare patient, there ain't a diagnostic test on the planet they're not going to run on them.
Exactly. And I'm going to bring Jonathan back in for a second, so that we can, all chat for a second together. But I think we really just need to drive this final point home, because this content, what we've been discussing today, is going to be something that we are going to use moving forward in newsletters, in advocacy to members of Congress, and to continue encouraging clinic owners and distributors to join the Alliance for Patient Care. But I wanted to bring Jonathan back in to talk a little bit about what happens when groups don't move quickly enough, because that's the essential piece here. Is we have until November to get Congress activated and on our side. We have until November. And for those of you who are like, it's September 15th, we have less than 2 months to make this happen. And it's a massive lift. It's going to require not just Jonathan, it's also going to require media teams, PR teams, to fight back against the people over at New York Times who continue, like Blake mentioned, calling this an expensive bandage. But Jonathan, talk about what happens when people don't take action.
Well, look, the fact is, opinions begin to solidify, right? The momentum is underway already. Let's make no mistake, our effort is going to be the disruptor. We're going to need to get in there and be the disrupting force to something that would otherwise just happen on its own. And so every day that's wasted, every day that's missed in that disruption is the day that you're allowing the opinions to solidify on the other side of this issue. And look, I just got to watch Yvonne and Blake. That passion that the members of this organization bring to the table is needed. It needs to be injected into the conversation. There needs to be a significant amplification of the voices on the other side of the current policy proposal, because in the absence of that, even before the actual formal adoption occurs, the decisions will have been made. The people who are responsible for making these decisions, they will get their mind set. And what we need to do is disrupt that, show them meaningful, passionate, reasonable arguments on the other side. Everything that I just heard checks all those boxes. I saw passion. I saw a logical explanation for why this isn't simply just, another expensive bandaging, why this actually has a difference on clinical outcomes. And then from Yvonne's perspective, he said, look, they're being short-sighted. The reality is, if clinics or clinicians, particularly mobile clinicians, are put out of business as a result of this, ultimately it's the patients who are harmed. And so we need to show the patient harm. We need to show the value of these skin substitutes, not just from someone who's only looking at the very short-term dollars and cents, but show them from a clinical perspective why the use of these skin substitutes ultimately saves money in the long run, and why it's going to result in additional expense if we don't do it. But walking in there with a one-pager isn't enough. It's being able to amplify that passionate advocacy on the other side, and to be honest with you, showing that it's impacting people like Yvonne and small businesses and patients is more relevant than just showing the big players that are at stake in this fight. Washington, D.C. is very used to seeing the big players fight one another. What gets people emotionally moved to action, whether it's members of Congress or other policymakers, is when they see that an issue touches a nerve in a way that suddenly a large number of smaller players get involved. And when we can package that properly, our advocacy team working together with the Alliance and the professionals that you have who can help support the messaging, when we do that, I think we can get some of them motivated to get involved. But to your point, every day that passes is a problem and a missed opportunity. I want to give you one other example of work that we've done at Converge in the past that's relevant. We saw that autism providers, these are specialized providers, were being aggressively on the receiving end of enforcement. And the primary reason for that, we believe, is because government hadn't adequately anticipated the amount that it would have to reimburse for these services. Well, rather than adjust policy, what we saw was policy making through enforcement, where there was a sudden crackdown on reimbursements through aggressive enforcement of the providers. And we stood against that. And we were very effective for our clients by going back to the relevant agency and saying, this is an inappropriate way to try and pursue a savings of funds, because the ultimate people who are hurt are the patients. And the clinicians, these are small businesses who exist to serve these patients. So we were able to help reroute that energy away from our clients into a more, what we believe is a more productive path and a more productive approach. I think we're beginning to see the same thing here, a short-sighted approach to saving funds that ultimately has a negative consequence for the patients and will probably not save funds in the long run. But if we don't get involved very quickly to make that case, the train has already left the station and it'll ultimately reach its destination. Sorry to mix so many metaphors, but at the end of the day, that's where we're going to be. So I would suggest, to the extent that we can get people motivated sooner, and it's not just about dollars and cents. You mentioned, there's a need to get people involved monetarily. I'd like to see if we can find ways to get them involved personally as well, and that'll be a mission for our firm. So we're not just looking for their dollars. We want to become team members with those people who join the Alliance to help get their stories out there and their points of view out there the way that we did today with Blake and Yvonne.
Awesome. Thank you, Jonathan. Before we wrap this up, Yvonne and then Blake, if you guys could just give your call to action, your plea to Yvonne, to your industry, and then Blake to to your fellow clinicians, and then Blake to your fellow distributors for getting involved in taking this last stand in these last 2 months that we have to fight for patient care.
Yeah. So, being a small business owner, there's always that feeling that I'm too small. I can't make a difference. And this is why these alliances like this are so important, because then we can make a difference. These numbers really do add up. There's strength in numbers. So, please, I know we're really busy in our day-to-day lives keeping patients alive, but we're not going to be able to do that unless we all act together now. And to all the rest of the listeners, I kind of just want to point out one more thing, that I don't know why we chose wound care to be the target of cutting costs all of a sudden. And believe me, I'm very much pro cutting costs, but you don't hear cancer treatments saying that, we're going to cut fundings to cancer treatments because everybody would be with pitchforks on the streets. Well, when we have a disease that has a higher death rate than cancer, why are we treating it so differently? Why are all of a sudden with that particular treatment, we're cutting costs and we're being budget friendly, even though that budget is really short-sighted and actually going to cost more? But why are we targeting wound care? Is it because it's predominantly a disease that affects those that have underrepresentation, those that don't have access to doctors? It's very disheartening to see, and especially, I know we brought it up several times, that article that called it expensive bandage is just, it's so dishonest that I don't know where to begin.
1000%. It is dishonest and it is despicable. And Yvonne, you and I have talked about this a few times. I think you're right. I think the answer is that many of these people who have paid into the systems their entire lives are kind of being targeted as not worth spending the money on, because they don't have a voice. Or if you look at the wound care population, the majority of non-healing wounds are in a lower income population. But again, we're talking about, people who did 20, 30, 40 years as blue collar workers. Blake, I know he helps treat a police officer up in the Panhandle, right? We're not talking about taking care of people who didn't pay into the system and didn't pay their dues. We're talking about taking care of people who paid into a system expecting Medicare to take care of them in their old age, who are now finding out that a treatment that could save their lives or at least save their limb is going to be taken away simply because people, bureaucrats in DC have decided it's too expensive. So, Blake, what's your call to action to fellow distributors before we wrap this up?
A lot of times we think that we compete against one another. There's a lot of us out there that are providing services to wound care, and some of us it's our full-time passion, and we've built entire businesses around it, Jennings. Some of us it's just something that we do ancillary. There's probably 2 or 3% of these guys that if the prices change dramatically, they're gonna jump out, maybe more. This is a real opportunity to collaborate, where you're not only looking to preserve your business model and to keep your employees in place and to continue to train and continue to invest in people, but it's an opportunity to really take a stand. And then we've seen it happen in so many other industries. Toxicology. We were in the middle of a drug epidemic, and all of a sudden there's a wave, and we changed the way that we're treating toxicology tests, and all of a sudden medication interactions don't matter anymore. The silent killer of the Medicare population doesn't matter anymore because of somebody's campaign. And something that Jonathan said, opinions started to formulate against it because some doctors were running pill mills that didn't like the way the toxicology industry was being run. We saw it with COVID and infectious disease testing, with PCR. We've seen it in DME, where you have industries that are helping serve people. Business guys like me have built a foundation, have built infrastructure, and then all of a sudden it gets wiped out, right? And so if you've been helping serve patient care for the better part of 20 years, if you're one of those business guys that has employees and you're staring at this saying, man, I don't know what to do, click the link, talk to Jennings, talk to Jonathan, talk to Elnatan, figure out how you can contribute. And I mean, as far as $5,000 a month, $10,000 a month, $15,000 or for the next 90 days, that's inconsequential. That is a no-brainer for a guy like me to be able to have access to talk to policymakers to help bend this back into the direction that benefits patients and helps us stay in place. Like, that's a no-brainer. That's my call to action, is don't be dumb. You pick up the phone. Oh,
yeah. And guys, thank you all for joining us. I'm going to have Jessica pull you guys off stage and put the join today back on, just for, final charge here. We're running out of time. We had time, but now is the time. Now's the time to fight and to make our voices heard and to do what's right for patients, and also do what's right for Medicare. Like Yvonne said, this is not going to make things cheaper. This is going to make things more expensive. We're stepping over dollars to get to dimes because the cost of an amputation, the cost of treatment of an amputation, the cost of these Americans' lives is far, far, far more valuable than the current cost per square centimeter of these advanced wound care products that do work. They do change lives. They do heal wounds. So for those of you who have joined, thank you. For those of you who have not joined yet, I would encourage you to join, get involved, and take a stand for an industry that is doing everything we can to take care of patients and take care of really the most vulnerable in our society. So thank you for joining us today. We're watching the replay. Again, you can call or text the phone number or send us an email if you have any questions about joining. But we look forward to having you in the Alliance for Patient Care so that we can make this push and fight back against just a terrible change. So thank you, everybody.